Hello everyone, welcome to AD Academy. എടുത്തിരിക്കുന്നത് booklet alpha code A ആണ്. Increase in RBC count is called dash. It is option A, polycythemia. It is an elevated red blood cell count. Anemia is a decrease in RBC. അപ്പോൾ നമുക്ക് ആ ഓപ്ഷൻ മാറ്റാം. And next option, thrombocytopenia and thrombocytosis is related to platelets. അപ്പം increase in RBC count is called polycythemia. Second one, parts of small intestine includes all of the following except. ഒഴികെയുള്ളതാണ് ചോദിച്ചിട്ടുള്ളത്. So it is colon. Body parts പഠിക്കുമ്പോൾ അതിലുള്ളതാണ്. So the small intestine consists of the duodenum, jejunum and ileum. The colon is part of the large intestine. അപ്പം except ആണ് നമുക്ക് ചോദിച്ചിട്ടുള്ളത്. Light receptor cell of the eye. It's very easy. It's cone cells. Cones ആണ്. So cones and rods are the photoreceptor cells in the retina. Cones detect color and bright light. Fourth one, fertilization takes place in which part of the fallopian tube? We have already discussed it. It is in ampulla. The ampulla is the widest, longest section of the fallopian tube. It is the typical site for fertilization. Fallopian tube ലാണ് നടക്കുന്നത്. ആ fallopian tube ഏത് പാർട്ടിലാണെന്ന് ചോദിച്ചാൽ it's in ampulla. Option B. Which of the following is a part of hip bone? It is pubis. Option B. The hip bone is formed by three fused bones. ഏതൊക്കെയാണ്? Ilium, ischium and pubis. So we can select option B, pubis. Next, hormone produced by posterior lobe of pituitary gland. It is oxytocin. Option C. The posterior pituitary stores and releases oxytocin and antidiuretic hormone or ADH. Who developed the first vaccine of the world for the smallpox vaccine? It is option A, Edward Jenner. He successfully developed the world's first vaccine for smallpox in the year 1796. Which of the following statement is or are correct about spirochetes? So spirochetes are elongated, motile, flexible bacteria twisted spirally along the long axis. ഇതൊക്കെയാണ് നമുക്ക് ഓപ്ഷൻ തന്നിട്ടുള്ളത്. Veil disease is caused by Treponema pallidum. Relapsing fever is caused by Borrelia recurrens. Blood agar can be used for culturing Treponema pallidum. അപ്പോൾ നമുക്ക് വരുന്ന ഓപ്ഷൻ B ആണ്. That is first one. First and option 3. These are the correct answer. നമുക്ക് correct ആണ് ചോദിച്ചിട്ടുള്ളത് regarding spirochetes. Okay. Reason നമുക്ക് നോക്കാം. Why the first statement is correct? It describes their physical structure. Then second എന്തുകൊണ്ട് incorrect ആയി? Veil disease is caused by leptospira, not treponema. Statement 3 correct ആണ്. Reason Borrelia recurrens causes relapsing fever. Okay. What about the fourth one? Treponema pallidum cannot be cultured on artificial media like blood agar. Next one, iatrogenic infection is dash. It's option B, infection resulting from investigate, therapeutic or other procedures. So an iatrogenic condition or infection, sorry, it's iatrogenic. Iatrogenic condition or infection is any adverse mental or physical condition included in a patient's by effects of medical treatment, diagnosis procedures or therapeutic intervention. So option B is the answer. Which of the following statement is or are correct about culture medium? Correct ആയിട്ടുള്ളതാണ് ചോദിച്ചിട്ടുള്ളത്. It is option C. അതായത് the first one, that is Ames transport medium is used for transportation of throat swab in patients suspecting diphtheria, and option 2 is also correct. Selenite F broth is an enrichment media used for inoculating fecal samples. Regarding culture medium ആണ്. So and also option 4 is correct. Robertson's cooked meat medium or RCM is a commonly used anaerobic medium. So അതുകൊണ്ട് നമുക്ക് option C ആണ് correct answer ആയിട്ട് വരുന്നത്. Reason, first, Ames transport medium is standard for throat swabs when testing for Corynebacterium diphtheriae. Second is also correct. Selenite F broth is a selective enrichment medium primarily used for isolating Salmonella species from fecal specimens. 3 is incorrect. എന്തുകൊണ്ടാണ്? Alkaline peptone water is an enrichment broth for Vibrio cholerae from stool specimens, not sputum. Fourth is also correct. Robertson's cooked meat, like RCM, is widely used for cultivating anaerobic bacteria. Next question. The ability of an individual to adapt successfully to his environment is called? It is option D, intelligence. Why? It's a widely defined in psychology as the global capacity of an individual to act purposefully, think rationally, and deal or adapt effectively with their environment. So, എല്ലാം include ചെയ്തുള്ള option D ആണ്, it's intelligence. Next, a nursing officer always complains that her colleagues are jealous of her abilities and trying to undermine her performance. On evaluation by the nursing supervisor, it was observed that there is no evidence of her argument and she expresses feeling of self-doubt regarding her own clinical competence. Which mental mechanism is she or he most likely exhibiting? It is option C, projection. So, projection is a psychological defense mechanism where individuals attribute their own unacceptable thoughts or unacknowledged feelings or shortcomings like self-doubt about competence onto others. So, it's like a self-defense, psychological defense mechanism. So, option C, projection ആണ് answer വരുന്നത്. 13th question. Among the following, which is not a theory of personality? Personality theory അല്ലാത്തതാണ് ചോദിച്ചിട്ടുള്ളത്, not ആണ് ചോദിച്ചിട്ടുള്ളത്. So it is option D, classical conditioning theory. എന്താണ് classical conditioning theory? It's a fundamental theory of learning that is developed by Ivan Pavlov, whereas type, trait, and psychoanalytical theories directly explain personality structures. So others we can eliminate. The outward expression of a person's inner thoughts and feeling is called behavior, പെരുമാറ്റം. So that refers to the action, responses, and observable outward conduct that reflect an individual's internal psychological states, thoughts, and emotions. Next question. Which among the following is not an external factor of attention? External factor അല്ലാത്തതാണ് option A, emotion. So emotion is an internal, not an external. But not an external ആണ് ചോദിച്ചിട്ടുള്ളത്. So psychological factor affecting attention like intensity, novelty, and size are external structural properties. So that we can eliminate the other options. Next, a patient on dietary restriction sees his favorite dish. Suddenly eats a large portion without thinking of consequences. Which personality component operates in this situation? It is id, ego, superego എന്നുള്ള classification ഒന്ന് check ചെയ്യുക. So id operates completely on the pleasure principle. അപ്പം ഈഗോട് ചോദിച്ചിട്ടല്ല, നമുക്ക് ഇതെന്ന് പറഞ്ഞാൽ നമ്മുടെ സ്വയം ഇഷ്ടത്തിന് ചെയ്യുന്നതാണ് without like thinking of the after effects. It demands immediate gratification regardless of negative consequences. Which aspect of the family cycle emphasizes the departure of grown children from the parental home and the adjustment of the family unit to an empty nest scenario? It is option C, that is launching stage, where the launching stage covers children leaving the household. This transition initiates the empty nest phase of the parents. Empty nest എന്ന് പറഞ്ഞാൽ എന്താ, നമുക്ക് മലയാളത്തിൽ ചിന്തിച്ചു നോക്കാം, ഒരു കൂട്ടിലെ കിളികളൊക്കെ വളർന്ന് പറന്നു പോകല്ലേ. അപ്പം അതുപോലെ തന്നെ ഇപ്പോൾ അബ്രോഡ് പോകുന്ന ഒരു മക്കളുടെ കാര്യം നമുക്ക് ആലോചിക്കാം. അപ്പോൾ പാരൻസ് വീട്ടിൽ ഒറ്റയ്ക്കാവും. അതുകൊണ്ടാണ് എംപ്റ്റി നെസ്റ്റ് എന്ന് പറഞ്ഞ ഒരു സിൻഡ്രോം ഉണ്ട്. സോ എംപ്റ്റി നെസ്റ്റ് എന്ന് ഉദ്ദേശിക്കുന്നത് അതിനെയാണ്. Which a sociologist is associated with the concept of the sociological imagination? It is option C, Wright Mills. He was an American sociologist, like Wright Mills. So he coined this term. He published his famous book on it in 1959. Next, how does socialization operate within a total institution? It's option D. It imposes strict control over all aspects of an individual's life, shaping their behavior and identity. Why? So total institutions break down old identities through isolation. They enforce rigid schedules to radically re-socialize individuals. So society there will be some like a center to like control us, and there will be some set patterns also. That's how socialization works as well. So ഒരു total institution എങ്ങനെ operate ചെയ്യുന്നുള്ളതാണ്. So strict control over all aspects of individual's life. അല്ലെ, നമുക്ക് പലരും പല ക്രൈം ചെയ്താലും അല്ലെങ്കിൽ ഒരു ഡിസ്റ്റോപ്പിയൻ രീതിയിൽ നമുക്ക് ചിന്തിച്ചു നോക്കിയാൽ we cannot live in that situation. So that if there is some ideal principles or some rules, it will be like good for us and for all. Next, which type of marriage involves the exchange of marital partners between two or more social groups, often to establish or strengthen social alliance? That is exogamy. that requires marrying outside one specific group. This practice legally and socially binds different tribes or clans. Okay, polygamy, ഇതിന്റെയൊക്കെ ടേംസിന്റെ മീനിങ്സും ജസ്റ്റ് നോക്കാം. Then polygamy means one or more like partnersനെ ഇതുള്ളതാണ്. Then endogamy, monogamy, you can do a little research about this. So here നമ്മുടെ established group എന്നല്ലാതെ so അതിൽ എക്സ്ചേഞ്ച് ചെയ്ത് മാരി ചെയ്യുന്നതിനാണ് exogamy എന്ന് പറയുന്നത്. Okay. Which of the following values focus on helping others and provision of the utmost health and welfare for the clients, their families, and the society with selflessness and self-devotion? ലൈക്ക് നമ്മളെ കവിഞ്ഞ് ബാക്കിയുള്ളവർക്ക് ഒരുപാട് ഹെൽപ്പ് ചെയ്യുന്ന ആൾക്കാർ, ഇപ്പോൾ ചിലർ ദ മേ ബി ലൈക്ക് ഫിനാൻഷ്യലി വെൽ, അപ്പോൾ അങ്ങനെയുള്ള ആൾക്കാർ ബാക്കിയുള്ളവരെ സഹായിക്കണം അവരുടെ വെൽഫെയറിന് അവരുടെ സൊസൈറ്റിക്ക് വേണ്ടി. സോ അതിന് പറയുന്ന പേരാണ് ആൾട്രൂയിസം. സെൽഫ്ലെസ് ആയിട്ട് ഒരാളെ ഹെൽപ്പ് ചെയ്യുന്നതിന് പറയുന്നതാണ്. Okay, the person will be unselfish concern for the other people's well-being. It's a foundational ethical value in healthcare fields as well. 22. Which of the following tips to be followed while communicating with the elderly? വയസ്സായവരോട് സംസാരിക്കുമ്പോൾ എന്ത് വേണം? Sit face to face with elderly. Okay. So face-to-face positioning maximizes eye contact, improves lip reading and aids comprehension. അപ്പം ഏജ് ആയവർക്ക് ചിലർക്ക് കാഴ്ചയ്ക്കൊക്കെ കുറച്ച് കുറവുണ്ടായിരിക്കും, അതേപോലെ തന്നെ കേൾവിക്കും. സോ അതുകൊണ്ട് അടുത്തിരുന്ന് ഫേസ് ടു ഫേസ് ആയിട്ട് സംസാരിക്കുന്നതാണ് നല്ലത്. സോ ദാറ്റ് ദേ ക്യാൻ ഓൾസോ ഗെറ്റ് അവർ ലിപ് മൂവ്മെന്റ്. ഓക്കെ, അതേഴ്സ് വി ക്യാൻ എലിമിനേറ്റ്. യു ക്യാൻ ജസ്റ്റ് റീഡ് ത്രൂ. Which color plastic bag is used for the segregation of incineration waste? We have discussed it. It is yellow. Okay. So yellow biohazard bags are standard for waste meant for incineration, such as anatomical or soiled waste. Infection caused by a normally harmless bacteria that become pathogenic upon favorable changes in their environment is called opportunistic infections. അപ്പോൾ ഇങ്ങനെ ആലോചിച്ചാൽ മതി, ഒരു തക്കം കിട്ടിയല്ലേ, ഫേവറബിൾ ചേഞ്ചസിൽ ബിക്കമിങ് പാത്തജനിക് ആവുന്നതാണ് ഓപ്പർച്യൂണിസ്റ്റിക് ഇൻഫെക്ഷൻ. അങ്ങനെ റിലേറ്റ് ചെയ്ത് പഠിക്കാം. സോ ഓപ്പർച്യൂണിസ്റ്റിക് പാത്തജൻസ് കോസ് ഡിസീസ് ഓൺലി വെൻ എ ചേഞ്ച് ഇൻ ദ ഹോസ്റ്റ് ബോഡി എൻവയോൺമെന്റ് ഓർ ഇമ്മ്യൂണിറ്റി അലൗസ് ഇറ്റ്. നെക്സ്റ്റ്, ISO സ്റ്റാൻഡേർഡ് കളർ ഫോർ ദ ഫസ്റ്റ് എയ്ഡ് കിറ്റ് ഇസ്. Next, ISO standard color for the first aid kit is option C, green with white cross. So it's ISO like 3864 mandates a green background with a white cross for first aid kits and emergency equipment. Next, two most important nutrients essential for the growth of hair are option D, iron and protein. ഇതാണ് മുടി വളരാൻ ആവശ്യമായിട്ടുള്ള nutrients, important nutrient. Hair consists of mainly protein ആണ്. Iron delivers oxygen to hair follicles for healthy cell division as well. Okay. ഇപ്പോൾ പ്രോട്ടീനുള്ള ഷാമ്പൂ ഒക്കെ യൂസ് ചെയ്യുന്ന നമ്മൾ കേൾക്കാറുണ്ട്, അപ്പം അത് ആലോചിക്കാം. Next, which one of the following is an osmotic laxative? It is option C, magnesium hydroxide. It's osmotic laxative, where magnesium hydroxide draws water into the colon via osmosis to stimulate bowel movement. The best site for giving an intramuscular injection to infants less than 1 year is vastus lateralis. The anterolateral thigh muscle is the safest, most developed injection site for infants under 1 year. Chest physiotherapy is contraindicated in increased intracranial pressure. So chest physiotherapy technique can elevate pressure inside the skull and that risking brain injury. A method of sterilization by steam under pressure by using a machine is called autoclaving. Sterilization method നമ്മൾ പഠിച്ചിട്ടുണ്ട്. So autoclaves utilize pressured steam to kill all forms of microbial life. Next, actions taken prior to the onset of disease which removes the possibility that a disease will ever occur comes under which level of prevention? We have discussed it. It comes under primary prevention. That prevents disease from the onset, start by eliminating risk factors. A health program launched by Ministry of Health and Family Welfare in order to fully immunize 90% of children who are either partially immunized or not immunized. 30 option B, Mission Indradhanush. This program targets full immunization coverage across India. ഇത് നമ്മൾ ഇന്നലെ പറഞ്ഞതായിരുന്നു. Limitation of freedom of movement of healthy persons exposed to communicable disease for a period of time not longer than the longest incubation period of disease is termed as quarantine, where that restrict healthy individual exposed to infections. In order to achieve elimination of lymphatic filariasis, which one of the following drug is administered nationwide as annual mass drug administration or MDA by Government of India? That is option C, diethyl carbamazine citrate. This drug is standard for eliminating lymphatic filariasis. Which one of the following vitamin deficiency can lead to keratomalacia? It is option A. Vitamin A deficiency causes several corneal drying and keratomalacia. Vitamin A deficiency also causes night blindness. അപ്പം eye related ആയിട്ട് പഠിക്കുക. Next, failure to achieve expected height as compared to healthy children of same age, which is an indicator of malnutrition over a long period of time. Termed as stunting, growth കുറയുന്നത്. So, low height for age indicates chronic long-term malnutrition. Next, pentavalent vaccine contains which one of the following antigens? It is option A. Diphtheria, pertussis, tetanus, hepatitis B, Haemophilus influenza B. Where pentavalent vaccine combines these 5 specific antigens. An infected person or animal that harbors a specific infectious agent in the absence of a clinical disease and serves as a potential source of infection for others is termed as carrier. Okay. So, carrier harbor pathogens without showing active symptoms. They can unknowingly transmit infection to others. Okay. ഇപ്പം അസിംറ്റമാറ്റിക് ആയിട്ടുള്ള കാര്യം നമ്മൾ ഇന്നലെ പഠിച്ചു അവരാണ് കൂടുതൽ നമുക്കറിയില്ല ഇപ്പം അവർ പോയ റൂട്ടും കാര്യങ്ങളും നമ്മൾ തരയില്ല കാരണം സിംറ്റം കാണിക്കുന്നില്ല ഇപ്പോൾ ഒരു പനിയായിട്ടോ അല്ലെങ്കിൽ ഒരു സ്മെല്ലില്ലാതെയോ അങ്ങനെ കോവിഡ് ഉണ്ടെന്ന് വിചാരിക്കുക ഉള്ളിൽ പക്ഷെ അതറിയില്ല പക്ഷെ ആളിൽ നിന്ന് വേറെ ആൾക്ക് ഇൻഫെക്ഷൻസ് പകരാൻ സാധ്യത കൂടുതലാണ് ഓക്കെ ദാറ്റ്സ് ഓൾസോ ഡേഞ്ചർ സൈൻ ഇപ്പം അതിന് നമ്മൾ പറയുന്നതാണ് കാരിയർ. Period from disease initiation to disease detection in a non-infectious disease is called as latent period. So, in chronic or non-infectious diseases, this is the time from initiation to clinical detection. Which of the following vitamin deficiency can lead to the development of megaloblastic anemia? It is vitamin B12 or B complex. The deficiency impairs DNA synthesis during the RBC production. This leads to abnormally large macrocytic cells. Which of the following assessment data indicates possibility of mediastinal shift after thoracic surgery? It is tracheal deviation. So, mediastinal shift forces structures away from the affected side. Also, tracheal deviation is a hallmark diagnostic sign. Best intervention for terminating ventricular fibrillation is defibrillation. That delivers an electrical shock to reset cardiac rhythm. It's a definite treatment for ventricular fibrillation. Next, edema of head and neck is seen in which of the following oncological emergency? It's in the superior vena cava syndrome. So, tumor compression blocks blood flow from the upper body. This causes severe facial, head and neck edema or swelling. Nursing assessment that will help in identifying hypocalcemia is option C, tapping the face in front of ear. This action tests for Shostak's sign. Facial muscle twitching indicates hypocalcemia induced neuromuscular excitability. Hearing loss that is caused by aging processes. Sorry, it is option D. Presbycusis is age-related progressive bilateral sensory neural hearing loss. What is the first priority nursing action in burns involving face, neck, upper chest? It's option B, airway establishment. So, burns involving the face, neck and upper chest place the patients at a high risk for inhalation injury and sudden airway obstruction due to edema. Maintaining airway patency is always the absolute priority. ABC rule നമ്മൾ പഠിച്ചു airway breathing then circulation clear ചെയ്യുക. അപ്പം ഇത്രയും കാര്യങ്ങൾ ശ്രദ്ധിക്കുക. ഫേസിൽ ആ ഭാഗത്തൊക്കെ ആകുമ്പം സ്വെല്ലിംഗ് ആയി പിന്നെ അത് എയർവേ ബ്ലോക്കേജ് ഉണ്ടാക്കാൻ സാധ്യതയുണ്ട്. അപ്പം ഫസ്റ്റ് എയ്ഡിൽ ചെയ്യേണ്ട കാര്യങ്ങൾ ഇത്രയാണ്. Which patients need first priority in a disaster? ആർക്കാണ്? A patient with airway obstruction. ബാക്കി എന്താ നമുക്ക് that are manageable. So, a patient with airway obstruction should be treated, given priority. So, in disaster triage, start method that patients with life-threatening but treatable conditions like an airway obstruction receive top priority or immediate or red tag. Patients without a pulse and respirations are triaged as expectant or decreased in black tag because limited disaster resources must prioritize those with the highest chance of survival. Okay, already black tag condition നമ്മളോട് പറഞ്ഞു. Which of the following is not a component of primary survey? It is head to toe assessment. So the primary survey systematically follows the ABCDE format, that is airway, breathing, circulation, disability and exposure. So a detailed head to toe examination is conducted later during the secondary survey. അപ്പം primary survey കാര്യമാണ് ഇവിടെ ചോദിച്ചിട്ടുള്ളത്. So not a component of primary survey ആണ് ചോദിച്ചിട്ടുള്ളത്. Most appropriate position for patient after total hip replacement is legs in abduction. Abduction എന്ന് പറഞ്ഞാൽ എന്താ, തട്ടിക്കൊണ്ടുപോകല്ലേ. സോ നമുക്ക് നോക്കാം. Following a total hip replacement, the affected hip must be kept in abduction or away from the midline using an abduction pillow to prevent prosthesis dislocation. So adduction, internal rotation and hyperflexion must be strictly avoided. Which medication is contraindicated in acute angle closure glaucoma? It is option D, atropine. Atropine is a powerful mediatric pupil dilator or pupil dilator. So dilating the pupil further narrows the iridocorneal angle and completely blocking the outflow of aqueous humor and dangerously increasing intraocular pressure. Role of community mental health nurse can be described as option C, extended role. According to standard nursing frameworks, an extended role refers to nursing practices conducted outside traditional hospital boundaries, where an expanded role describes increased autonomy and specialist development within clinical nursing limits itself. National Mental Health Program launched in the year, which is in 1982. Okay, NMHP. So the Government of India launched the National Mental Health Program in 1982 to ensure the availability of minimum mental health care for all citizens. Ego defense mechanism or undoing is typically seen in OCD people, obsessive compulsive disorder. So undoing is a defense mechanism where a person attempts to cancel out or counteract an unacceptable or anxiety inducing thought or action by performing a specific ritual behavior. This is a defining characteristic of obsessive compulsive disorder, OCD. Which of the following is not a therapeutic impasse? It is empathy. So transference, counter-transference, boundary violations are therapeutic impasse. So a therapeutic impasse represents a block or deadlock in the nurse-patient therapeutic relationship, like resistance, transference, counter-transference or boundary violations. Okay, resistance and the include the point, so you can just note this. So empathy is vital, constructive tool used to facilitate healing rather than blocking it. Increased suicidal tendency is associated with alteration in the brain level of serotonin. Okay, so suicide tendency ആൾക്കാരിലുള്ള serotonin കൂടുതലായിരിക്കും. So decreased or altered levels of neurotransmitter like serotonin or 5-HT in the central nervous system are heavily linked to severe clinical depression, impulsivity and increased suicidal risk. Early diagnosis and prompt treatment is included in secondary prevention, that aims to detect a disease early and treat it immediately to arrest its progression. Primary prevention focuses on preventing disease onset, starting lana. Secondary like early diagnosis. So while tertiary prevention deals with rehabilitation after idu vandayinu shesham. The cognitive triad of depression described by option B is Aaron Beck, where he described the cognitive triad, which consists of 3 types of negative thoughts. ഇതിനാണ് triad എന്ന് പറയുന്നത്. ഒന്നെന്ന് പറയുന്നത് നെഗറ്റീവ് വ്യൂസ് അബൌട്ട് വൺ സെൽഫ്, അയാളെ പറ്റിയിട്ടാണ് നെഗറ്റീവ്, ആൻഡ് അബൌട്ട് ദ വേൾഡ് ആൻഡ് അബൌട്ട് ദ ഫ്യൂച്ചർ. Okay, or you can call it as a pessimist, where optimist is positive, where pessimist like hopes for something that will end up in negative. Drug of choice for dopamine induced seizures is option C, clonazepam. For drug induced seizures such as those caused by dopaminergic overactivity or stimulants, benzodiazepines like clonazepam are the preferred choice, whereas standard antiepileptics like phenytoin are generally less effective or contraindicated. 59. Aversion therapy is based on principle of classical conditioning. So aversion therapy pairs a maladaptive behavior like alcohol consumption or anything with an unpleasant stimulus like nausea to create an aversion to it. Aversion means dislike. So number of chapters in National Mental Health Care Act in 2017 is 16 chapters. Okay. And also with 126 sections. Play during infancy is what type of play? It will be solitary play, where during an infancy 0 to 12 months, children engage in solitary play, where they play alone with toys without interacting with nearby children. Next, dash is a warning sign of impending seizure in a child. That is option B, aura. Aura is an perceptual disturbance or sensory warning sign of experienced right before a seizure start. 63. Acute rheumatic endocarditis follows infection by group A beta hemolytic streptococci. It's a bacteria. So rheumatic fever and subsequent endocarditis developed as a delayed non-separative complication of a pharyngeal infection caused by group A streptococcus or streptococcus pyogenes. Cola colored urine is seen in which type? It's in option C, acute glomerulonephritis, where damage to the glomeruli allows RBC to leak into the urine, which alters its color to a characteristic smoky or cola appearance. So glomerular filterലാണ് നമ്മുടെ ഇതൊക്കെ പ്യൂരിഫൈ ചെയ്യുന്നത് nephritis, sorry, kidney. Next, a child with diabetes mellitus presents with sweating, tremor, confusion, lethargy, and tingling sensation around the mouth. So, what do these symptoms indicate? It indicates hypoglycemia. Okay, these are the symptoms of it, and also are neuroglycosinic and autonomic symptoms of low blood sugar or hypoglycemia. So, OPV should be stored at temperature of minus 20 degrees Celsius. The first and most common symptom of indisposition is option C, vomiting. Next, and abdominal pain and palpable mass will be a congenital heart disease that can be cured medically. That is PDA. This patent ductus arteriosus, PDA, can often be cured medically using indomethacin or ibuprofen. These medications help close the ductus in premature infants. Urinalysis report shows a specific gravity of 1.03. Which of the following conditions can be suspected in a child? It's dehydration. Okay, high urine specific gravity. This is the measures indicates concentrated urine, and this is a primary laboratory indicator of dehydration. Head circumference and chest circumference will be equal at dash months, at a month of 12, where head circumference and chest circumference are normally equal at 12 months or 1 year of each. Which among the following is welcomed as a sign to rule out? It is cephalon-pelvic disproportion. So option is lightening. Lightening is the engagement of the fetal head into the pelvis. This doesn't rules out significant. It is C, cephalon-pelvic disproportion. Okay, it is C. Next, a composite graphical recording of salient features of labor is called a partograph. We have discussed it. Where is a composite graphical record used to monitor the salient features of labor progression. A frank breech means it's option C, breech with extended legs. Frank breech presentation means the fetus has hips flexed and knees extended with feet close to the head. Methargine is contraindicated in a heart disease, where methargine or methylgonovin causes vasoconstriction and can increase blood pressure. It is strongly contraindicated in severe heart disease and preeclampsia. A menstrual disorder characterized by cycles that occur too frequently, specifically lasting fewer than 21 days, that is known as option D, epimenorrhea. Frequent ആയിട്ട് periods ആവുന്നത്, or polymenorrhea എന്നും പറയുന്നുണ്ട്, refers to menstrual cycles that occur too frequently, specifically lasting fewer than 21 days. 21 days-നേക്കാൾ കുറവായിട്ട് വരുന്നതാണ്. A silicone device inserted into the vagina to provide structural support for pelvic organs in uterine prolapse and stress urinary incontinence is pessary. A vaginal pessary is a removable silicone device inserted to provide structural support for the uterine prolapse, and stress urinary incontinence. Which among the following statement regarding control contraction is not correct? Not correct ആണ് ചോദിച്ചിട്ടുള്ളത്. So option D, pushes the fundus downward and backward while pulling the umbilical cord. So not a statement. That is correct. Where control contraction requires pushing the uterus upward or countertraction. Countertraction. Pushing downward increases the risk of uterine inversion. So we can eliminate. A scoring system used in the induction of labor is Bishop score. What the Bishop score rates cervical readiness before inducing labor. It evaluates dilation, effacement, consistency, position, and fetal station. The hormone that is primarily responsible for gestational diabetes mellitus is option A, human placental lactogen or HPL, that increases maternal insulin resistance. This mechanism ensures adequate glucose reaches the fetus but can cause gestational diabetes. Next, the technique used to resolve the impacted shoulder in shoulder dystrophia is McRoberts maneuver. This we discussed. So this maneuver involves hyperflexing the mother's leg against her abdomen, where it rotates the pelvis to release the impacted fetal shoulder. The process whereby knowledge is created through the transformation of experience includes, it's option D, experimental learning. Where this is the exact definition of experimental learning theory by David Kolb. It emphasizes learning through reflection on doing. Which of the following are the determinants of learning? Needs of the learner at a state of readiness, preferred learning styles. So all of the above. Option D is the correct answer. So learning depends on what the learner needs and so their physical and emotional readiness to accept it and their preferred learning style. Philosophy formed to make the learner perfect with creative values and adjusting to changing demands of societies. Eclecticism, option B, where it combines the best elements of different educational philosophies to adapt flexibly to the changing needs of learners and society. Which of the following are the characteristics of formative assessment? The formative assessment in the characteristics ആണ് ചോദിച്ചിട്ടുള്ളത്. It's option A, only 1 and 2. So it should be focused and it should be frequent. So formative assessment is focused and frequent. However, it requires continuous detailed feedback rather than limited feedback. Feedback കുറവല്ല. So that should be also continuous. Which of the following are the types of student-centered teaching style? So option C, only 1 and 3. So it should be facilitator and also a delegator. In instructional design, facilitator and delegator are the student-centered styles that guide or give autonomy to learners, whereas demonstrator style is teacher-centered. So there won't be student involved in that. What are the statistical factors to determine sample size? It's option D, all of the above. So determining sample size requires calculating the population variability, so degree of variability, effective size, and significance criteria. Okay. Which of the following non-experimental design is based on purpose of the study? It is correlational. So non-experimental design ആണ് ചോദിച്ചിട്ടുള്ളത്, where is classified by time dimension, cross-sectional, longitudinal, or by research objective, correlation, or descriptive. What are the threats to internal validity? So option C, 1 and 3. Section bias and attrition. So section bias and attrition threaten internal validity, where novelty effect threatens external validity. Qualitative data is presented in the form of option A, which is 1 and 2. Bar diagram as a pictodiagram, where bar diagrams and pictodiagram display categorical data. What about the scatter diagram? That require quantitative variable. Which level of measurement includes classification of data based on categories? Option A, nominal scale, where a nominal scale classifies data into distinct categories, where they contain no numerical or order ranking. Next, which principle of management is concerned with the sincerity, respect, and observance of rules and regulations of an organization? It's option D, discipline. That means respecting organization rules. It requires obedience and respectful behavior. So there will be some regulations when we are working under any institution. In which leadership style the nurse manager gives the subordinates high degree of independence in the nursing unit? It's related to laissez-faire policy. The style offers complete independence. Among the following ethical principles, which one is concerned with taking action to benefit and to promote the welfare of other people's beneficence? Okay. Who is the chairperson of Niti Aayog? Prime Minister. It's a repeated question. The Prime Minister of India acts as the ex officio chairperson of Niti Aayog. In inventory control, VED analysis is done based on criticality of items. So VED analysis stands for vital, essential and desirable. That's a sorting inventory based on how critical items are to everyday operation. So DASH is the system of patient care delivery in which one nurse is responsible for the total care of assigned patients round the clock from admission to discharge. So അതിനാണ് നമ്മൾ പറയുന്നത് primary nursing, where primary nursing provides 24-hour accountability and coordination of the patient care by a single nurse from hospital entry to exit. Okay, the time from admission to discharge. Which among the following is an example for a comprehensive method of performance appraisal where the input comes from multiple sources about the employee's performance? It's option B, 360-degree feedback appraisal, where a 360-degree appraisal gathers performance feedback from supervisors, colleagues, subordinates, and sometimes from clients as well. Next, a false spoken statement damaging a person's reputation is known as slander. Okay, using defamatory spoken words while libel refers to written defamation. Next, manpower planning is closely associated with which function of management? That is staffing. ഇത് നമ്മൾ ആ ഒരു കാറ്റഗറിയിൽ പഠിച്ചിട്ടുണ്ടായിരുന്നു അല്ലേ? So manpower planning determines human resource requirement which falls directly under the staffing function of management. Last question. Dash is the process of assigning responsibility and transferring required authority to the subordinates, ensuring accountability. It is delegation, option B, where it involves assigning specific tasks and giving authority to subordinates while maintaining overall accountability. ഒരു ഇൻസ്റ്റിറ്റ്യൂഷൻ ആയാലും അതിലൊരു അഡ്മിനിസ്ട്രേഷൻ ഒരു ഹയറാർക്കി ലെവൽ ഉണ്ടാവും ഫ്രം മാനേജർ ടു എംപ്ലോയി, പിന്നെ അങ്ങനെ അതുപോലെ പല സബോർഡിനേറ്റ്സിനും അവർക്കൊരു കൺട്രോൾ കൊടുത്ത് ബട്ട് ലൈക്ക് എക്സിക്യൂട്ടിംഗ് ദ പ്ലാൻസ് as well in the different levels. Okay, ഇത്രയാണ്. So thank you all for watching this video. ആൻസേഴ്സ് നിങ്ങൾ ചെക്ക് ചെയ്യുക, എത്ര സ്കോർ കിട്ടി എന്നുള്ളത് കമന്റ് ചെയ്യുക. See you in the next session.